Welcome back to my YouTube channel Lab Guru. Today we are proceeding toward the set number 2 of topic phlebotomy, and our first question is, which factor most significantly affects the potassium results during the difficult vein puncture? And our options are: option A is fasting status, option B hemolysis, option C posture, and option D is tourniquet time. So here the right answer is option B hemolysis, because hemolysis releases the intracellular potassium and falsely high result of potassium is obtained. How you can see here, it is a cell and these electrocytes are intracellular. High amount of potassium is intracellular and low amount of potassium is found in the extracellular fluid. So potassium is the major electrolyte which is inside the cell. When hemolysis occurs, these red cells rupture and this potassium goes outside from the cell. So the high result of potassium is obtained. Question number 2. Most affected prolonged tourniquet application. What is the most affected if there is a prolonged tourniquet application? First one, option A is the sodium, option B total protein, option C chloride, and the option D is bilirubin. So the right answer is total protein, because due to the prolonged use of the tourniquet, the hemoconcentration occurs, and this hemoconcentration increases protein, calcium, and RBCs. You can see here some proven laboratory effects like falsely increase in the total protein, albumin, calcium, hemoglobin. These tests are affected by the prolonged tourniquet application. Okay. Why this happens? This happens because the venous stasis moves plasma water into the interstitial space. Because once you tie the tourniquet for a long time, there is some concentration happens. This concentration effects result in the increased protein, calcium, and RBC result. Question number 3 is, failure to invert tubes immediately results in after blood collection. If it is failure to invert the tubes immediately, what will be the result? Option A is hemoconcentration, option B microclot formation, option C is lipemia, and option D is hemodilution. What is the probable failure? What is the probable result after failure the inverting these tubes? The right answer is option B, microclot formation, because inadequate mixing causes the small clot. There is no proper mixing between the anticoagulant and blood, so small clots may be present there. Small clots may be formed, so it may result into the analyzer blockage and rejection of the sample from the laboratory. Question number 4. Blood culture contamination mostly due to: option A is due to the wrong tube, option B poor skin antisepsis, option C delayed transport, and the option D is hemolysis. So the right answer is poor skin antisepsis. Before proceeding toward the blood collection, if our skin is not disinfected properly, it can cause the blood culture contamination. Skin bacteria enters into the samples and false positive culture may be results. Next, collapsed vein during blood collection may be caused by: option A is the large needle, option B is the excess vacuum, option C is the shallow insertion, and the option D is the slow flow. The right answer is option B, that's the excess vacuum, because of strong suction. Okay, strong suction collapses fragile veins. And next, for which test specimens should be transported on ice immediately? Option A is cholesterol, option B is the ammonia, option C is hemoglobin, and option D is platelet. For which test the specimen should be transported on ice immediately? Here the right answer is option B, that's ammonia. ammonia rises quickly at room temperature. That's why it must be chilled. And why it happens? Because of after blood collection, the metabolic process continues in the RBCs and WBCs, which releases ammonia and causes level to rise at room temperature. So to minimize the effect, to minimize this metabolic process, we send this sample in the ice. We keep the sample in the ice. So this metabolic process will be delayed. Question number 7 is a glucose sample processed after 3 hours at room temperature shows low glucose. Why? Our options are option A, hemolysis, option B, glycolysis by cells, option C, lipemia, and option D is light exposure. So the right answer is option B, glycolysis by cell. After blood collection, the RBCs, the cells consume the glucose and goes for the glycolysis metabolism. So they utilize the glucose present in the sample and falsely decreased value of glucose is obtained. The next is petechia after tourniquet removal indicates option A is thrombocytopenia, option B is hemolysis, option C is infection, and option D polycythemia. What is petechia? It's the condition in which tiny red-purple spots distal to the pressure site where we are using this tourniquet, it occurs. Okay, so the right answer is thrombocytopenia. Thrombocytopenia means low platelet level. Low platelets causes the capillaries more fragile, and these fragile capillary results in the petechia. You can see in the picture the tourniquet was applied here, and below this area you can see the red purple spots. This is the condition called the petechia. Question number 9. Falsely elevated calcium caused by what is the reason behind falsely elevated calcium? The options are option A is EDTA contamination, option B hemolysis, option C prolonged tourniquet use, and option D is delay. So the right answer is option C, that is prolonged tourniquet. As we learned in the question number 2, the same condition is applied here. Due to the hemo concentration, protein bound calcium is increased. Question number 10. If ABG sample left uncapped for 10 minutes before analysis, okay, if ABG sample is left uncapped for 10 minutes before analysis, expected effect, what will be the expected effect? Option A is the increased partial pressure of carbon dioxide. Option B is the decreased partial pressure of oxygen. Option C is the increased partial pressure of oxygen. And option D is there will be no changes. So here the right answer is option C, increased partial pressure of oxygen. And why it happens? Because atmospheric air typically has the higher oxygen tension, right? In the atmosphere it's about 150 mmHg, but in the arterial blood it is 80 to 100 mmHg normally. So due to the diffusion, the environmental oxygen goes towards the sample, so it will be increased. But same like in the carbon dioxide, the partial pressure in the arterial blood will be high and in the environment will be low, so the carbon dioxide will be decreased. Okay, so remember both the condition. If the ABG sample is left uncapped for few minutes outside in the environment, what will be there? There will be increased in the oxygen level and decrease in the carbon dioxide level. Okay, as there is no option for decrease, but if it is left, you have to remember oxygen will be increased in the sample result and the carbon dioxide will be decreased. because it will be diffused toward the environment. So question number 11, which of the following is the preferable site for bone marrow aspiration and biopsy in the adults? The options are iliac crest, option B is sternum, option C is tibia, and option D is spinous processes of a vertebra. So the right answer is option A, that is iliac crest. This site is the safest and most easily accessible, with the bone just beneath the skin and neither blood vessels nor nerves. So it is very easy to access it. You can see in the picture here there is no artery, no vein, no nerves, and very close to the skin. So it is more preferable. Question number 12. A patient with a history of mastectomy on the right side requires blood collection. The best side is, the condition was the patient has the history of mastectomy. Mastectomy means the surgical removal of breast. Of one side they have removed, mean this right side they have removed. So the right option will be, we have the options right median cubital vein, right cephalic vein, left antecubital vein, and right basilic vein. So the right answer will be option C, left antecubital vein. Why? Because we have to avoid the vein puncture on the same side of the mastectomy due to the risk of lymphedema and infection. So she had mastectomy on right side, so we are choosing the left antecubital vein. Question number 13. Which vein is most prone to causing nerve injury if accessed incorrectly? The options are median cubital, option B is cephalic, option C is the basilic, and option D is dorsal hand vein. The right answer is basilic. Basilic vein have more prone to causing nerve injury if it is accessed incorrectly. Why? Because basilic vein lies close to the nerves and arteries. It has the highest risk of injury. That's why we are choosing the basilic vein is the last option. You can see in the picture, this picture showing the basilic vein here, the blue color, right? But you can see here, it is surrounded by the network of nerve and artery. There is a brachial artery very close to this basilic vein. There is a median nerve very close to the basilic vein. So it is at high risk of injury. Question number 14. Order of draw is primarily designed to prevent. Why we are choosing these orders for blood collections? What is the reason behind it? Option A is hemolysis. Option B, to prevent cross-contamination of additives. Option C is there to prevent from infection. And the option D is there to prevent from clot formation. The right answer is option B. That is cross-contamination of additive. We have to avoid cross-contamination of additive because every tube have different anticoagulant, right? So in this way we have made one order of draw so to prevent the carryover of additives between tubes affecting the result. The question number 15 is, which gauge needle is most appropriate for routine adult vein puncture? What size of needle, right? The options are 16 gauge, option B is 18 gauge, option C is 21 to 23 gauge, and option D is the 25 gauge. This size is the size of needle hole. Okay, the bore in the needle is measured in the gauge. So the right answer is option C, that is a 21 to 23 gauge is preferred for adult vein puncture. It provides the adequate blood flow and minimal chance of hemolysis. Question number 16. Which gauge needle is most appropriate for transfusion practice? You can see here, it's not asking for the routine vein puncture, it is asking for the transfusion practice. Options are option A 16 gauge, option B 18 gauge, option C 21 to 22 gauge, option D is the 25 gauge. and the right answer is option B, that is 18 gauge. It helps in the rapid transfusion or emergency situation where fast flow is required and also help to prevent the hemolysis. Okay. Question number 17. For blood alcohol testing, skin antiseptic must. Option A is iodine, option B is alcohol, option C is the chlorhexidine, and option D is the non-alcohol solution. The right answer is the option D, that is non-alcohol solution, because alcohol antiseptics can contaminate the alcohol region. So we are using these non-alcoholic solutions. Question number 18 is, which patient position reduces risk of syncope? Syncope means fainting. The options are standing position, option B is sitting unsupported position, option C is the reclining or lying down position, and option D is walking. So the right answer is option C, that is reclining or lying down. Reclining or lying down prevents the injury if fainting occurs. Syncope means fainting. Okay. Question number 19 is, which condition causes difficult vein access due to collapse? Option A is the polycythemia, option B dehydration, option C is the hypertension, and option D is the obesity. The right answer is dehydration. Dehydration reduces blood volume and can collapse the vein. Dehydration can collapse the vein. Question number 20. Patient with severe thrombocytopenia require blood draw. Best practice will be to apply strong pressure after. Option B is use large needle. Option C, avoid pressure, and option D is short tourniquet time only. The right answer is to apply strong pressure after the blood collection, because there is a bleeding risk. The bleeding risk is high for these patients, so apply prolonged pressure after drawing the blood. Question number 21. Vein feels hard and cord-like. The likely condition might be option A, the healthy vein, option B, thrombosed vein, option C, dehydration, and option D is the hematoma. So the right answer is thrombosed vein. Thrombosed vein are not suitable for vein puncture. If you puncture the vein, it will be very tortuous and tight. Question number 12. Patient allergic to iodine antiseptic. If the patient is allergic to iodine antiseptic, which antiseptic you will provide instead of this? So the options are alcohol, option B is chlorhexidine, option C povidone iodine, and option D is the hydrogen peroxide. The right answer is option B, that the chlorhexidine. Chlorhexidine is preferred alternative if iodine allergy is there for this patient. Question number 23. Specimen collected above IV infusion shows dilution. Which analyte affects most? The options are option A is hemoglobin, option B is glucose, option C is electrolytes, and option D is platelets. The right answer is option C, that is electrolytes. Okay, but you can see here, after dilution most of the test results are reduced, like glucose, hemoglobin maybe due to the diluted sample it will be reduced, but electrolytes sometimes increases. Why? Because in this IV infusion, the saline, the sodium chloride is there, so it affects the sodium level and electrolyte will be elevated. Here the hint is IV fluid dilute the electrolyte significantly, but not diluting If the IV fluid have the electrolyte, it will add more. Okay, so increased electrolyte level will be seen there. Elevated level of electrolyte, mainly the sodium. Question number 24. Patient on anticoagulant therapy requires option A, short pressure, option B, no pressure, option C, extended pressure, and option D is the immediate discharge if the patient is an anticoagulant therapy. The right answer is option C, that is extended pressure. It prevents the prolonged bleeding and hematoma. Because due to the use of anticoagulant, the bleeding may be prolonged. So to prevent that, we have to give a extended pressure. Question number 25. Which pain has lowest risk of complication? As we know, we have the options. Option A is the basilic, option B is cephalic, option C is median cubital, and option D is the hand vein. As we know, the most preferable vein site is median cubital for the blood collection because it have very lowest risk. Median cubital is the stable and very away from the nerves, so it is very easy to collect the sample from the median cubital vein. Question number 26. Most critical phlebotomy step affecting the patient safety. Options are: option A is tube mixing, option B is patient identification, option C is the needle size, and option D is tourniquet removal. The right answer is patient identification. Misidentification can lead to the wrong diagnosis and wrong treatment also, so you have to careful for that one. Next, what is the color code for 22 gauge needle which is commonly used for the intravenous medications? Options are: option A blue, option B red, option C yellow, and option D is the green. The right answer is option A, that's the blue color. You can see in this chart, this blue color have the 22 gauge needle size and the diameter is 0.27 inch or 0.70 mm. Okay. Moving toward the next question. Question number 8. As the gauge number of a needle increases, read it very carefully, okay? As the gauge number of a needle increases, what happens to the size of the needle? What is the relation between the gauge number and the size of the needle? Here the options are: it gets larger, option B is it gets smaller, option C is it stays the same, and the option D is that it gets longer. So the right answer is it gets smaller. If your needle size is increasing, means the needle gauge is increasing, it means the size will be decreased. If your gauge number is decreasing, then your size will be increased. It will be like a indirectly proportional. You can see here the 25 have the internal diameter of 0.25 mm. But when this gauge number increasing, when the gauge number is increasing to the 27, the internal diameter is going to be decreased. It is 0.20 now. When it is increasing more, going to the 30 gauge, the size of the needle bore is going to be decreased, 0.15 mm only. So if the gauge number is increasing, it means the size of the bore, size of the hole of that needle will be decreased. Okay. Next, which of this is the appropriate needle color for subcutaneous or intradermal injections? What is the color? Here the option C is pink, option B is the green, option C is the red or purple, and the option D is grey. Again, the right answer is option C, that's a red or purple. You can see in the same chart here also, the 25 gauge needle have the color code of red, and the internal diameter have 0.20 inch or 0.53 mm. Question number 30. What is the recommended distance to apply a tourniquet above the vein puncture site when you are going to proceed a blood collection phlebotomy, where you have to tie up this tourniquet? Option A is 1 to 2 inches above. Option B is the 3 to 4 inches above the puncture site. Option C is the 5 to 6 inches above, and option D is directly over the site. So the right answer is option B, that is 3 to 4 inches above.
So this was the last question for today. See you soon.